Surgical hand preparation and OT etiquettes.
Hi, I'm Professor Dr. Tengku Kamarul Zaman, the Director of University of Malaya Medical Center. Over the years of being a director in this large hospital, I have to say that one of the biggest problems that I have to deal with is surgical site infection. Surgical site infection makes up one of the highest incidents of hospital-acquired infection and is a big problem. It's not a problem just in this hospital, but also in all hospitals worldwide. In countries such as third world countries and developing countries, surgical site infection can occur in one of three patients that undergo for surgery. And this poses a big problem because it raises the rate of mortality and morbidity. WHO has published a global guideline on the prevention of surgical site infection, and one of it is to talk about good surgical hand scrub. Of the 29 of the strong recommendations given, this probably remains one of the most important aspects which many hospitals tend to forget, and a lot of our healthcare professionals take it very lightly and just ignore the basic principles of good hand scrub just prior for surgery. In this, I hope that our doctors, our healthcare providers will take a deep thought and understanding of how to do proper hand hygiene or hand scrub, which prevents infection rates, and this saves lives. Remember, clean care is safer care.
Surgical site infection are caused by bacteria that gets in through the incision during surgery. 11% of patients who undergo surgery are infected in the process. Millions of lives are threatened every year as a result of the healthcare-associated infection. That is why preventing the infection is very important. Operating nurses are the main workforce in operating theatres and play a key role in ensuring asepsis. It is vital to reduce the risk of patients developing SSI with proper surgical hand preparation prior to setting up of the first patient and in between. By taking the appropriate infection control measures, nurses can play their part in promoting patient safety by adhering the best practice. Clean care is safer care.
Surgical hand preparation. Before you start your preparation, there are do's and don'ts. Do remove all hand ornaments before beginning surgical hand preparation, including rings and wristwatches. Do ensure that you perform surgical hand preparation in sinks designed to reduce the risk of splashes. And do wash your hands with plain soap before the preparation if they are visibly soiled. Do not wear artificial nails in the OT. Do not combine washing with antimicrobial soap and water with alcohol-based hand rub in sequence. And lastly, after using a brush for the first case of the day, do not brush your nails and hands for subsequent cases, as this practice is not recommended by WHO and there is no evidence of any additional antimicrobial benefit. Surgical hand preparation can be done using two methods: the alcohol hand rub method and the antimicrobial soap-based method. Apply the rub to dry hands and follow manufacturer's guidelines for duration. The duration of surgical hand preparation is 3 to 5 minutes. However, it is advisable to follow what is recommended. Alcohol-based surgical hand preparation. First, put approximately 5 ml of alcohol-based hand rub in the palm of your left hand, using the elbow of your right arm to operate the dispenser. Dip the fingertips of your right hand in the hand rub to decontaminate under the nails, then smear the hand rub over the left forearm up to 2 inches below the elbow. Do this with a rotating motion and ensure that the alcohol fully evaporates. Repeat these steps for the right hand and arm. Again, using 5 ml of alcohol-based hand rub, dip the fingertips of your left hand in the hand rub to decontaminate under the nails, then smear the hand rub over the right forearm up to 2 inches below the elbow, again with a rotating motion. Ensure that the alcohol fully evaporates. Take another 5 ml of hand rub and rub palm against palm with rotating movement. Rub palm to palm, back and forth with fingers interlinked. Then rub the back of the left hand, including the wrist, moving the right palm back and forth and vice versa. Rub the back of the fingers by holding them in the palm of the other hand with a sideways back and forth movement of the thumb, and repeat the same motion for the other hand. Next, rub the thumb and the region between the thumb and the index finger of one hand with a sweeping motion of the other thumb, and repeat this step on the other hand. When the hands are dry and the alcohol has fully evaporated, sterile surgical clothing and gloves can be donned. Antimicrobial soap-based surgical hand preparation. Brushes are not recommended by WHO, but can be used for the first case of the day. The running water. Apply 5 ml of the medicated soap solution and work it to the palms of the hands. Rub the back of your left hand with the palm of your right hand with fingers interlaced. Do this up to 10 times. Repeat with your right hand, ensuring the same frequency. Ensure the same frequency for the following steps. Rub palm to palm with fingers interlaced, then clasping your hands together, rub your left thumb over your right knuckles and repeat the same action over the other hand. Then, clasping your left thumb in your right hand, rub your thumb and the web space between the thumb and the index finger in a sweeping motion with the thumb of your right hand. Do this for the other hand. Next, clasping the right wrist with your left hand, continue rubbing down the forearm in a rotating motion up to 2 inches below the elbow and repeat for the other forearm. When you are done, rinse your hands and arms thoroughly by passing under the running water, ensuring that each pass must be made in a single direction, from fingertips to elbows, to avoid contamination. When rinsing is complete, allow the excess water to drip into the sink without shaking the arm. Repeat steps 1 to 7, keeping your arms raised above your elbow at all times. The next wash should cover 2/3 of the forearm to avoid compromising cleanliness of the hands, and repeat once again, a third time up to the wrists only. When you are done, sterile surgical clothing and gloves can be donned now. Drying hands after antimicrobial based hand preparation. Open the sterile gown pack from inside to outside, being careful not to touch the sterile gown. Take the sterile towel and move away from the table so that it does not touch the table. Let it unfold freely. Grab one edge of the towel and blot down from the fingers to the arms and elbows. Make sure not to move back over previously dried areas. Then flip the towel to catch the opposite edge and repeat the same process. Proceed immediately to gowning up. Donning of sterile surgical suit. Surgical gowns are folded from inside out before packaging. Surgical gowns have two surfaces: an inside surface that is in contact with non-sterile scrub suits and bare skin of hands and arms, and an outside surface that is considered sterile only from the waist to the axillary line and from hands to the elbows. After drying, grasp the surgical gown on the inside surface and step away from the table, allowing the gown to unfold freely and taking care not to touch any unsterile surface. Look for armholes and place hands and arms inside the sleeve. Pushing your hands and arms horizontally without lifting the arms above the head, stop just before the cuffs. The assistant will secure the gown, then glove immediately using close technique. How to glove using close technique. When practicing close gloving technique, think of the gloves as having two planes, the inside and the outside. Before gloves are touched, both inside and outside are considered sterile. As soon as the gloves are touched, the inside is not sterile. Do not allow your fingers to protrude outside the cuffs of the gown. Maneuver the sterile gloves onto your hands with your hands hidden from view. To open the sterile glove wrapper, grasp the two center edges and open the wrapper. Position your left hand palm facing up. Pick up the glove with your right hand, not going past the cuff, and place the glove on your left hand, palm to palm and cuff to cuff. The glove is placed correctly if the fingers point towards the wrist. Grasp the upper edge of the cuff and advance your left hand into the glove. Repeat the process for the right hand. How to do open gloving. This method requires an assistant who is already sterile. The sterile assistant should pick up the sterile glove dropped into the sterile area and stretch it open by holding the inverted cuff, ensuring that the orientation of the glove is thumb to thumb and finger to finger. Slide the matching hand into the open glove, ensuring not to touch any non-sterile area. Repeat the same method for the other hand. Do not use the ungloved hand to ease the application of the glove, as the other hand is not sterile. The assistant should pull the cuff of the glove to fit over the cuffs of the gown to ensure no exposed skin. Once you are done, do not touch any non-sterile area, as you are sterile. During an operation, there are many don'ts that we need to be aware of as part of the surgical team. Let's begin with surgical team etiquette. Do not lift your arms above your shoulder level while gowning or fling them about. Be careful not to touch any non-sterile area. After you are gowned up, keep your gloved hands at the level considered sterile. Do not fold your arms, do not lean against unsterile areas, and do not place your hands below the waist or on your hips. Do not touch any non-sterile area or equipment. The OT also has an etiquette. Do not open theater doors while surgery is in progress. To prevent interruptions, a notice can be displayed outside doors. Do not distract the surgeon while surgery is in progress, or touch the surgeon or sterile field. And lastly, do not crowd behind the surgeon while surgery is in progress and distract the surgeon.